I'm Dr. Mary DiBartolo, Professor of Nursing at Salisbury University and host of the program. I welcome today Tony Adrignolo from Peninsula Orthopaedics. You are an orthopedic surgeon, and I saw you at a conference not too long ago when you talked on this topic, and we said, let's do a show because it's so important. It's about falls and fractures in older adults. So let's talk about that very important issue that's about safety and preventing injury and why and how we can prevent them. So let's start with some statistics.
Well, we're here to talk about falls and fractured bones, and mostly we're going to focus today not so much on the younger person who's hurting themselves in sports. This is really going to be focused more on the geriatric population or the older population. In life, unfortunately, we all peak at 18 as far as our bones go. So we start small, our bones grow in mass and thickness and density, and they peak at around 18 years of age, give or take. After that, it's all downhill. We lose, which is a sad thought, but about at 18, it starts going downhill. And it goes downhill very slowly. We lose about 0.3%, which is not a whole lot of bone mass every year. It's not really clear why that happens, but it definitely happens to men and women. Obviously, the higher you start, the longer it takes you to get to the point where your bones really thin out. Darker skinned people tend to have thicker bones than light skinned people do. Men tend to have thicker bones than women just biologically. This goes on until your end. You lose 0.3% a year unless you're a woman. Unfortunately for women, when they hit menopause, they will have an accelerated bone loss phase where they can lose up to 30% of their bone mass in 10 years. So a man in 10 years is going to lose 3%. The woman loses 30%, and she started probably from a lower level. So women tend to be more at risk for osteoporosis for this reason. Men, when they get osteoporosis, a lot of times are sicker. Women get it just biologically. They all lose at 30%. Men don't, but when they do lose bone density like that, it's usually because they have some other medical problem going on that causes them to lose it. So,
and what would that be?
It can be renal disease, it could be liver disease, it could be cancer treatment, any other type of systemic injury where you're not walking or you've been, bed confined or, not exercising. So there are probably a whole plethora of diseases. But when men get osteoporotic and fractures, they tend to have poorer health than women in general.
So both are at risk for fractures.
So both are
if
at
they
risk.
Fall.
Women, even if they're in great shape, are at risk. Men are at risk, but it tends to be they have something else going on too than just the loss that everyone gets.
Well, let's talk about the other risk factors that seem to be occurring as people age besides thinning bone in and of itself.
You mean other risk factors for falling
Yes.
or for fractures?
Well, for falling. Let's start with
Let's start with
falls,
falling.
and then we'll get to fractures.
Everyone's at risk for falling. What we call an osteoporotic fracture, sometimes we call it an insufficiency fracture, and your bone is insufficient. That is a fracture that happens from a fall that would not fracture I wouldn't say a normal person, but a person with normal bone density. So an 18-year-old or a 30-year-old trips on their rug and falls. For the most part, they won't break their hip. Occasionally you have bad luck and land wrong, but for the most part, that's not sufficient force. An 80-year-old trips over their rug and falls, they break their hip. So you're looking at things that cause falls probably in all people sometime, but of course, as you get older, your risk for having significant injury is more severe. And this is an older statistic, about 250,000 hip fractures a year in the United States from osteoporotic insufficiency reasons, not from like motorcycles or stuff like that. About 350,000 it's back fractures, another 250,000 wrist, shoulder. So that's a lot of broken bones a year. And that's actually a couple of years old, is probably hitting 300,000 now, probably for hips. Things that you can do to prevent falls, one is your environment, obviously. Step stools, ladders, you have to be careful of them. You used to step wrong off a step stool and you twist your ankle, now broken hip. Ladders, obviously. Vision and hearing problems can lead to falls, dizziness. Unfortunately, as we get older, sometimes we accumulate a pile of medications And
Or
dizziness.
just getting up too quickly sometimes,
sometimes,
with the
yes,
meds. Yeah.
can cause low blood pressure type things. And a lot of people do not take their medications correctly, which is probably a whole nother series. But a lot of people take meds they're not supposed to, more than they should, less than they should, don't understand. That all increases the risk of having low blood pressure, dizziness, or some kind of adverse reaction, especially to cardiac meds or pain meds or sleeping meds, which tend to, be an issue for types of falls. Other things, bathroom, very dangerous place in the house. You have small spaces. Straining in the bathroom can cause you to be vagal, meaning your blood pressure drops. Standing from sitting. You have wet floors. You have ledges to go over in bathtubs, which are slippery to start with. All of this makes that also, a somewhat dangerous place, especially if you haven't made appropriate modifications.
I think bathrooms are very scary,
Yes,
and that's why people should put grab bars and things. And if you do fall, you think about hitting your head on something hard with the toilet and the tub and the sink and everything else.
Handrails, they have walk-in tubs now. They have all kinds of modifications that can be done to a bathroom to make it more accessible and safe.
And some of them are not without too much expense. I think, you see these advertisements for these fancy tubs and things where you can just walk in, but we know that can be very expensive.
Yeah. And a lot of the therapists who come out and do home therapy, sometimes they will do home evaluation where they'll walk through your house and say, okay, well, you can do this, this, and this to try and make it safer, just as an aside.
Yeah, we'll summarize all those, but I also wanted to bring in, you mentioned about medications being confused or not taken, and sometimes that's because people may have some mild dementia and forget to take their meds or just be more prone to falls. That could be a whole separate risk factor, correct?
Dementia is certainly another risk factor for falling. Mild dementia, probably not as bad as obviously severe. As dementia progresses, sometimes things that you kind of forget things that you've learned and don't process things quite correctly. So, for example, someone with advanced dementia will see a rug with a black circle in the middle, and they'll walk up to the black circle and they'll stop because they don't realize that's a rug. They think it's a hole. But when you have visual things like that, you walk and then you trip because you think there's a hole in front of you. It's not. It's a complex pattern that you're just not processing correctly. But there are, resources for dementia type things as well.
Well, before we reiterate all the things people can do to prevent falls, let's talk about why we want to prevent falls so much. It's because of the fractures that require surgical repair, and then there's a whole list of things that can occur when one has surgery.
Hip fractures in particular, which is the one that we mostly worry about, actually, it's interesting that people are poor judges of what is risky, let's say, or what's dangerous. So for example, if I ask you, what are you afraid of? Are you afraid of breast cancer or a hip fracture? Almost no one will say the hip fracture. They'll all say, well, I get my mammogram, I'm worried about my breast cancer. We're talking women that are at higher risk for fracture. But the statistic actually is that you are just as likely to die of a hip fracture as you are breast cancer as a 50-year-old woman. So if you look at your future.
As early as 50?
Not at 50, but if you look at your next however till you die.
Okay.
And you look at how many people die from breast cancer as women to how many people die from a complication or fall, it is actually the same amount. But if you ask someone, do you get your mammogram every 2 years or a year, whatever? Yes. Do you get your bone density? Never had one. So you have two things that have an equal risk of killing you in the future and having significant, and hip fractures actually, even if they don't kill you, will have significant morbidity. People think, oh, it's a broken bone, they just fix it. Hip fractures are not like joint replacements. You come in with orthopedic, we give you a new one from an arthritic hip, and you walk out and you're back to, all the baseball, running and skiing even. Hip fractures are not the same. When you fracture your hip, only about a third of people will ever get back to their baseline ambulatory function. A third of people will lose one level of function, meaning if you were walking in the house, outside with a walker, in the house without, you'll no longer walk outside and you'll be using your walker in the house. Another third will lose over 2 levels of function. So that's 66% who will never get back to how they were. So it's not like this is a minor problem, especially if you were kind of just managing. Well, this is the thing that throws you off the edge of not being able to independently live. So you can't think that, oh, it's just a simple break, I'm going to fix it, I'm going to do great. Because even though it fixes, it heals, the outcomes are not the same as an elective surgery. Right. So this is, a significant problem for families and patients. The worse, men tend to do worse than women as far as their rehab goes, again, because they tend to be sicker when this happens. You have some very healthy women who just have poor genes. They had light skin, they didn't get a good peak bone mass, but otherwise they're healthy. Men tend to be sicker, so they don't rehab as well. Patients with dementia, especially as it gets more advanced, do not rehab as well, especially once your mini mental status, your cognitive level gets under 15, give or take. You don't rehab as well. Now, mild dementia do tend to do fairly well. It takes a little longer, a little more persistence maybe, but can have good outcomes.
Well, that's good to know, because I know that was very scary for people with dementia
Right.
that have falls. As a nurse, I think of the complications of immobility, because you can be at risk for blood clots and pneumonia. And of course, there's a lot of things we do now. The standard of care in hospitals is very focused on preventing those complications, but they still can happen.
They can still happen. And the problem again with hip fractures are you're really stuck with fixing them. Because if you don't fix them, you're almost guaranteed to have those. Because if you don't fix it, you'll never be ambulatory. It hurts, so you don't want to move even out to a chair. And you're pretty much setting yourself up for bed sores and pneumonias and the other problems of being bedridden. And it is somewhat amazing how quickly things like bed sores can occur. Like in young people, it is not easy to get a bed sore. An 18-year-old sitting in bed for a day or two with a broken leg is not going to get a bed sore. An 80-year-old within 24 hours often have them. So it's a whole...
because of nutrition too, isn't it? Sometimes...
Obviously, nutritional status in elderly is not as good, and blood flow is not as good,
Right.
and padding is not as good.
I was going to say, not as much fatty tissue there. Yeah, there's a...
And nutritional status is clearly a risk, and it's an interesting thing that you look at someone and you say, well, they're heavy, so they must be well nourished. And that's actually not true. There are plenty of obese people who are actually malnourished. So if you look at albumin protein levels, they're not good. Now, yes, they look heavy and saying they can't be malnourished, they can't be at risk for these type of things, but actually they are. It's just, sugar and being nourished are two different concepts, so to speak.
And they can have other complications from surgery just from being obese. So.
Yeah, well, obesity, diabetes, or risk for infections, in particular, it makes your rehab harder. It's harder on your heart. It's harder on your lungs. And then age makes everything a little harder. And if you have a little baseline dementia, sometimes it doesn't take much to throw that into a more acute phase. There are plenty of people who at home are very well compensated. They do the same routine, but you take them out of their routine, and all of a sudden they're like, oh, they're demented, or their dementia's horrible. It's like, it's always been horrible. It's just in home you haven't seen it.
Yeah, they're in more of a comfort zone in a familiar environment.
Because a hospital is a scary place. Not only is it a scary place, but there are a lot of people involved. The average hip fracture person will see 60 different people.
60, did you say?
In the hospital.
Okay.
Because you have nutrition, right? You have the people who clean the room every day. You have nurses aides, you have doctors, you have therapists, you have OTs and PTs and radiologists and anesthetists and OR nurses. And by the time you get through all this, it is a very daunting number of things that are going on all day long.
Yeah. So I guess we've made a good argument that it's best to prevent a fall and potential fracture. So let's go through some very specific points about how to prevent these from happening. And of course, exercise and staying physically active can help.
Exercise can definitely help. Obviously, the better shape you are in, I shouldn't say obviously, but the better shape you are in before something happens, even if it does, the better the chance you'll be in good shape afterwards. So if you were running marathon or walking 5 miles a day and break your hip, there's a much better chance that you're going to walk 5 miles a day. If you were barely getting up off your couch twice a day, to go to the bathroom, obviously your post-op is not going to be as good. exercise keeps your muscle stronger. You're less likely to fall if you have good muscle strength and tone. So, all of that is good if you can keep it up.
I know, I'm thinking this is a double-edged sword because I'm thinking of all these baby boomers that a lot of them are extra active and exercising and may be in better shape, but at the same time, I also think of them as more fearless and willing to climb up on that ladder thinking, I can do this, and then next thing you know, they have a fall.
Yeah, maybe. I don't know whether the people before baby boomer were, the greatest generation. They probably did all that stuff too,
And stubborn about it,
about
I
it.
can still do that, but I'm sure you see it all the time, climbing ladders and step stools and things.
Ladders, step stools, especially changing light bulbs.
And the other thing I think of too is I've known plenty of people have hurt themselves slipping on the ice and the snow, and of course winter is tough around here.
It's tough around here, especially since we're not very good at plowing. But ice and salting and sanding, up north they're prepared for that. Here sometimes it's the sun will come out eventually, it'll melt.
I started wondering about why so many seniors do move to warmer locations in Florida. I mean, that you take that out of the equation, if you go to a place that never has snow or ice.
Sometimes it's wise to think, do I really need to do this now?
True.
Even for young people, sometimes it's wise to think, do I really, we are the very impatient generation nowadays. Do I absolutely have to go out in a snowstorm because I want to go to the store today? Maybe the answer is no.
Yeah, stay home.
And that's not just the age of young people are the same way.
Exactly. And some other things, eyes and ears, having your vision and hearing tested, that can be important.
Yeah. Obviously, if you can't see, it's hard to avoid things to fall over. Hearing, when you can't hear, it's very disorienting when you can't hear what's going on around you. Also, ears are intimately related to balance. Yeah. So a lot of people with ear problems do have vertigo problems.
And you did mention about medications. Some can make you dizzy, and be careful.
And it's always good to talk to your doctor about what you're taking, whether you need to take it all anymore. Doctors are very good at adding pills, and we're very bad at subtracting pills. So, if you're 90, do you need to still be on all the blood pressure meds? Maybe you don't anymore. Do you need to be on that cholesterol? Maybe you don't. And the other problem is when you get so many of them, if you actually just go to a person in the street and say, take 2 pills twice a day, very few people actually can tell you I'm supposed to take 2 pills in the morning at 8 o'clock and 2 pills at night with dinner at 8 o'clock. Less than 40% will actually take those pills correctly. And we're not talking dementia, we're just talking when the bottle instruction says that. So when you get 10 different pills with instructions, it's very easy to forget how you're supposed to take them.
Well, the pill organizers
are and now they have very fancy ones that actually automatically ring a chime and dispense the pills when they're programmed. So you don't even, so it's pretty automatic. So that can be very helpful. And of course, a lot of people take other people's pills. Here, take one of these, my doc, it works for me, that's never a good idea.
And I guess related to that would be being careful with alcohol as you age too. You don't process it well. It doesn't take as much to create where you're not as on balance as you should be, type of thing.
Alcohol is, even for young people.
Yes, true. That's true.
What does one of our trauma surgeons say? If it wasn't for alcohol, motor vehicles, and gravity, I'll never be out of a job for those 3 things,
Exactly. And then, of course, we talked earlier about standing up slowly, especially if you're on certain medicines that may cause your blood pressure to drop. And again, here we get to sleep again, how important it is to get a good night's sleep, which is a problem in this country overall, I think.
It's a problem in this country, and dementia patients often have trouble with sleep anyway, and older people often have trouble, period, with sleep.
Do you find with some of your patients that they're also stubborn about using a cane if they really do need it or could benefit from it?
And there are plenty of people who are stubborn about cane or physical therapy evaluation or even home modifications.
And what are the biggest ones you'd recommend, or that you do recommend,
for
home modifications?
Handrails in the bathroom, probably number 1. Number 2, something on the stairs outside. Are probably the biggest modifications aside from cleaning up your clutter and getting rid of the throw rugs, which are all free things to do, obviously. Lighting, adequate lighting, night lights in the bedroom so you're not walking around in the dark. And they make those lights now. I know I don't love them because the colors, I hear they're getting better, the LEDs, but they last forever. So, if you put them in mom's home, she will never have to change them. They last. They're good for, not forever, but 20,000 years or whatever it is.
Yeah, exactly. If you live that long. And I know one of the things that I think is kind of nice is those motion sensor lights, where it just comes on when it senses you're
Motion
up and
sensors
moving
are
around,
good.
which is nice.
The other thing, while we're talking technology, even though it's not quite fall prevention, they actually have. I mean, I hate the commercial where someone's, I fall, and then they got the, but they actually are helpful things. And they actually have ones that are, like your iPhone, have accelerometers in them, so that when you fall, it actually goes off automatically. You don't have to push the button.
Oh, really?
It actually senses that it had a jar.
Is that a special app?
It's not for your phone. It's actually, you wear it like
around your neck, you're saying?
Like the first alert type of thing,
Okay.
or that type of thing. You wear it as a bracelet or whatever, but when you fall, it picks that up and actually will activate without you having to
Press the button.
Right.
Yeah,
So
I was
even
wondering about that.
So even if you're unconscious, it still sends a message. So.
Now here's something I want to say that's more for the women, the fashionable women. Smart shoes as you get older, maybe
Even as you're younger, probably, but as you get older, it's probably not a bad
heels
idea.
On some shoes.
And they're not good for your feet either.
Yeah.
They cause bunions and hammer toes, which are the bane of a lot of people's existence.
I know. Once you get foot surgery, it seems like you're just never the same.
It's not fun.
It isn't. Yeah.
It is not fun.
Not the best outcomes there. So smart shoes, rubber soled, non-skid, low heeled, all those things.
I mean, we can fix some of that stuff, but you'd rather not have the just. And obviously, as you get older, it's harder to fix all that stuff because you have to be off your feet for a while. And try using crutches at 30 or 40 or every 10-year-olds make it look easy, but even 20-year-olds have trouble keeping weight off of one foot. Just spend a day. I'm not, if I don't want you to fall doing it, but try to get up your stairs or get around your house without putting weight on a foot, even with crutches. It's very difficult. Try standing up from a sitting position without putting weight on it. It's very difficult to do.
Yeah, exactly. And that's a big part of therapy, is just teaching people how to walk with crutches and navigate stairs and things like that.
Yep.
So, is there any one point you really want to drive home before we wrap up?
Well, I think there is one important point again. Again, the best prevention is Ben Franklin, prevention, an ounce of prevention is worth a pound of cure, and goes back before that. The Greeks had similar sayings. But it is true, and the time to prevent your osteoporosis is when you're 50. It's not when you're 80. When you're 80 and you have severe osteoporosis, you take the pills, and yes, it helps a little, but it's cat's out of the bag already. The time you want to stop your osteoporosis from progressing is when you're 50, because that's when you're going to get the bang for your buck. So for the younger people in the audience, like I said, bone density and broken hips it's not a fashionable disease. The test is cheap. There's no expensive treatment for it, really. The pills are generic. It's not one of those glamorous diseases that you hear about all the time. But when you think about, yes, I am as likely to die from my hip fracture over the course of my lifetime as I am from my cancer. A bone density it's a cheap test. It takes 1 minute. And if you find your osteoporosis when it's starting and you're 55 or 60 and you prevent it from getting, that's really the time to make the difference in your life. So you don't want to leave it till someone says, it's 75. Oh, maybe you should go get where you've had your first fall. Say, oh, we better check your bone density now, because you're kind of down the path already.
What about even younger people? Calcium, the diet, or taking supplements? Do you recommend that? The calcium, vitamin D?
The research on that has been very questionable at this point. I don't have a good answer for that, because the British just came out a couple of months ago with a big study where they say the calcium, vitamin D is worthless as a preventative. So there are some people who disagree with that.
A lot of people take calcium.
A lot of people
and vitamin
take
D.
it, and I don't know quite how to answer that because the studies are not conclusive. If you eat a reasonable diet, do you need it? Possibly not. Vitamin D, again, people don't know everyone argues on what a level of vitamin D is. Whether some people think it should be higher than others. We live in a society where our vitamin D levels tend to be low because we don't spend much time outside.
Like we used to,
now the plus is your skin cancer is lower, but you're right. But you're so that's kind of an area where it's not hard to give you good advice on what to do. Too much calcium causes things like kidney stones and things like that. The research is really it's like that with almost every vitamin if you've
Right.
noticed. One year, it's the best thing since sliced bread, and the next year, you shouldn't take it at all, and the next year, you should take it again. And calcium's kind of been going through that a little bit right
The
now.
roller coaster ride.
Yeah.
Yeah. What about exercise? We can always recommend exercise. as being a good
Exercise,
thing.
yes, that is one thing that's never gone out of vogue. You know, well, you don't have to do a lot, but 20 or 30 minutes a day, if you can do it. And it's not like you have to go run if you have an exercise bike and you do 20 minutes watching the TV, or you walk up and down your driveway for 15,
Just brisk walking, they say.
brisk walking is fine. It doesn't have to be high intensity. Obviously, a little cardio might be good for your heart, but anything is.
And what about
worth
weight
doing.
resistance? Should you have that component added to the cardio?
It all depends on the you definitely want weight-bearing exercise because that's good for your lower extremity and spine bone density. As for how much upper extremity weights you should do, it's hard to say because you can have overuse injuries from doing too much. As you get older, you can do a push-up and tear a rotator cuff. So how much of that to do is hard to say. The benefits, obviously, of having more muscle mass is it helps you control weight because muscle chews calories, and the more muscle mass you have, and most people do recommend you mix up some aerobic with some weight training. As you get older, probably the weight-bearing walking is probably more important than doing the pure, going in
Lifting,
pumping
yeah.
weights.
Yeah, but I guess it can't hurt. You just have to be careful with the
Right.
technique and the amount of weight.
Yeah,
would have
because
to
you
be
can definitely
adjusted.
get overuse injuries from lifting. Some things like the control machines are better. Now the problem is most of us don't have those in our house.
Right.
The Nautilus machine, they keep your arc in a and you can't get in abnormal positions. Like if you're lifting a bar, you can get off balance and hurt yourself.
Right.
Those machines control your motion. That's actually true for things like exercise bicycle. Even young people, I'm approaching 50, but things like squats, very hard on the knees. Things like bends to straights, very hard on the knees. We tend to recommend controlled motion, like ellipticals, stair strap, or something where you're not really stressing yourself.
What
too
about
much.
jogging as you get older with the stress of hitting the pavement?
As long as your feet are okay and you feel okay, I don't think that's much a problem. Long distance running's a little hard on the body, but light jogging's probably fine.
And swimming, of course, is...
Swimming's great. It's not weight bearing.
Right.
That's the one downside. You're not really, for bone density, it's not weight bearing, but it's good aerobic exercise.
Well, you said it helps to have some extra muscle. It might prevent you from falling.
and
Grab
most
yourself.
exercise people will say you want to cross train. You don't want to do you want to do a little swimming. You want to do a little weights. You want to do a little aerobic. Not just one thing.
Right. Plus, it keeps it interesting too.
Yeah,
I
like
think
it-
they
like
found
one day
people
is
can
it-
get bored with exercise, and
One day it's your aerobic day, one day is your swimming day, one day is your bicycle day, just to keep it mixed up and use different parts.
well, all very good advice. Thank you, Tony,
Well,
for
thank you,
being on
Mary.
the program.
Very nice to be here.
And thank you for joining us for this edition of Focus on Health here on PAC 14.